Give us an idea of what rosacea is, what people should look for. I feel like this is something a lot of us might have or notice and not know enough about.
Yeah, that many of us just think that it's due to being in the sun too much, or maybe drinking a little bit too much alcohol, or just when you drink some red wine. And those things may be triggers for the condition, but this is actually a condition that affects 16 million Americans. And it can be quite distressing. When we look at quality of life surveys on these patients, 50% of them will tell you that they've actually haven't been involved in certain social activities, haven't gone out of their house, or even called sick from work because of the condition. So it does affect people because there's a visual impression when someone turns red in front of you. They look more nervous, they look unsure of themselves, so people might cancel a presentation because of this.
What exactly are the symptoms?
So the symptoms are redness, especially when you're hot or you're under stressful conditions. That redness and flushing that usually comes on with heat, especially after a hot shower, will eventually remain permanently red, and you'll see blood vessels all over your face, specifically around the nose and the cheeks and chin. And then over time, if left untreated, then you can get more like pimples and bumps. And people think that it's acne, but in fact it's rosacea. So the common mishap is that people treat it like acne and they irritate their skin, making it worse. The most notable thing with this condition is people just think that it's a superficial skin condition, but 40% of those with skin rosacea can actually have ocular rosacea. And this can be debilitating because it causes a lot of inflammation to the eye, and over time, left untreated, can actually start impairing vision.
So how do people determine for certain that it is rosacea and not acne or something else?
That's a great question. So not treating your own acne, going to see a board certified dermatologist so that they can make that differentiation for you. Generally that redness is kind of like this photo, central facial redness along the mid of the forehead, the nose, and the cheeks. Not so common, you don't get it as much along the jawline, which is generally more hormonal acne. And it always will flare with being out in the sun, doing like hot yoga, coming out of a hot shower, where your regular acne wouldn't necessarily get worse under those conditions.
So 16 million Americans affected by this. Who's most likely to get this? How do you get it? How do you treat it?
Yeah, so for whatever reason, it comes on usually after the age of 30 versus your acne vulgaris, which presents usually in your teens and early 20s. And this generally has been associated with those of Northern European descent. So most have been found to be Irish, and then second to that, 26% tend to be of English descent, and then the rest from the Scandinavian countries. And so there's definitely a genetic component to it. But probably the most favorable thing, the good news around it all, is that there are treatments. So there are topical medications if you intervene early. If you're just getting the flushing, at this point, the most effective treatments are lasers. But if you're getting bumps, you should definitely see a dermatologist to make sure that you're not irritating it with your over-the-counter acne medicine, which will only make it worse.
Can you cover it up with makeup? Do people try to do that?
You could cover it up with makeup, but still people are very self-conscious about it, especially because it's something that you get with later age. It's like greater than 30 years of age. But it's important to be seen by a professional, because if you have eye conditions of rosacea, ocular rosacea, 40% of patients who have the skin rosacea, that can definitely be debilitating if you don't treat it.
Now, is this something that people live with indefinitely with the treatment, or can it be cured?
So there's no cure, as in most skin conditions like eczema or psoriasis, but we have excellent treatments that can keep it at bay, so that you can always keep it, at almost a mild in its severity.
Before we let you go, it's interesting, this is now Rosacea Awareness Month.
Yes.
Right, so to make people aware, obviously it affects 16 million Americans, but this is not something that's new. I was reading that this has been written about from, I don't know, 2,000 years, 3,000, 4,000 years ago.
Absolutely.
And in Shakespeare times it was written about, it's been recognized, I guess, in people for a very long time.
It is. I think that people have just been subject to just live with it. Like, you deal with it. Stop drinking the red wine. There's no doubt that triggers, in 96% of the cases, it makes it worse, right? But I think that people are being more sensitive to the fact that it does really affect people's quality of life, and that you can also have eye symptoms from it. It's the ocular rosacea that people aren't aware about.
All right,
Yeah.
good information. We are now more aware of it. Thank you
Yes.
very much, and it's good to let everybody know what to look out for. So, Dr. Fabi, we always appreciate you coming in. If you want to learn more about rosacea, we got some information on our website, fox5sandiego.com.